My name is Michael Cooper. I practice in Whitensville, Massachusetts, and I've been in practice here for almost 7 years now. A lot of our patients like to have us as their dental home and like to come and have everything done in one location, and we really enjoy getting to know our patients, getting to know them on a personal level, and build those relationships with our patients. The dental schools are great about teaching you clinically and how to be a good clinical dentist, but they don't always do a great job about business management, practice management. EDIC is really fantastic about kind of filling in the gaps and making sure you're successful as a dentist, not just as a good clinical dentist, but as a good practicing dentist. The main thing about EDIC is they're by dentists for dentists. Their entire board are dentists. So they've all been through this. They've all gone through the process of dental school and getting into practice, buying a practice, transitioning, and so they know what it's like. So a huge advantage is they offer discounts for your first 4 years. They also offer a lot of free continuing education credits. They have webinars which are free, which are fantastic. And they send you clinical advisories that you use in your practice every day. They have an 800 number which you can call anytime and get help if you have a claim or to prevent a problem or just a business question, and they're happy to answer that. It's extremely important to me that my risk management company only focuses on dentists. I want a company that is concerned about me, that doesn't put me on the back burner, because dentistry is a very specialized field. It's really important to have a company that understands that really recognizes the day-to-day issues that dentists face and the trials and tribulations that we go through. EDIC has really helped me to become a better dentist, because it's not only knowing what's important from a clinical aspect, but also being able to protect myself, and in that regard it helps to protect the patient, because they really help with their continuing education to keep you up to date with some of the most the newest techniques coming out, some of the most important issues that dentists face, and has really been a benefit to me in practice.
My name is Neil Patel. Right now, I'm a third-year student at Tufts University. I'm currently practicing within the clinic. We have our own patients now, which is really exciting. I'm also very involved in student organized dentistry and the American Student Dental Association. My first EDIC event was a Young Dental Advisory Committee meeting. The EDIC Young Dental Advisory Committee is made up of EDIC staff, young dentists, and students in dental school. We're just basically talking about problems that you're going to face as a new dentist, challenges that you're going to face as a student. And so for us to have EDIC hear us and listen to our concerns is fantastic. EDIC keeps us informed through having lunch and learns at our school, where they go in and they talk to students about current events, they talk to students about dental insurance, just important things for students to know when they're in school, because it's going to be one of the first challenges they face when they leave school. They're very generous with sponsorship of our local ASDA events. It's very clear from the get-go, no matter who I'm talking to from the company, that they're very focused on their members. All of the members are shareholders in the company. It's a company that's created and run and controlled by dentists. They've all practiced dentistry. They all know what happens in the field. They're familiar with exactly what you'll be seeing in your practice and the kind of problems that can arise, and they're going to be there to support you when those problems happen. EDIC provides for us as students a dental transition guide that shows you how you're going to be transitioning from the role of student provider to provider. And in that guide, you'll find links on how you're going to choose your insurance company, how you can start getting involved in your state dental society, and how you can even prepare for things such as interviews that will help you take that next step in your dental career. It's been a few months that we've been in clinic, but working with patients so far has been a really refreshing and nice change of pace in dental school. And it's actually so far been my favorite part of the dental experience, is dealing with patients, working with people, working with my hands, and helping people smile. My least favorite thing about dentistry is all of the things that come in between you and your patients. And EDIC is actually there to help you with the transition to becoming a dental provider. They're there to help you with your new practice. It says to me that EDIC cares, and that's actually very unique. Not only are they interested in being there for us as a dental insurance company if problems arise, but that they're also interested in our growth and development as dental providers and future dental leaders. And for them to be there to foster our growth from our period in dental school through our transition into young dentists and onwards is really phenomenal.